aim is to reach every individual suffering from spine issues who is unable to receive treatment. Let's make India stronger and free from spine issues.
Hello, this is Dr. Bhojraj from the Spine Foundation, and I would like to introduce Dr. Suman Dhar, who is very much part of the Spine Foundation. He worked with us and became an independent spine surgeon, and now he's a consultant in Tripura, Agartala. After training with us, he also went abroad and got trained as an overseas trainee in the UK, and now he is a very busy spine surgeon in Tripura, Agartala. He has offered and to help us help the Spine Foundation in our activities in the Northeast, and he has taken charge of all the activities which we plan to do for the poor and unreached population, tribal, non-tribal in Northeast. So along with the Assam University, Dr. Vivek, Dr. Demi and two of us, we have started outreach program in Silchar to start with in the Northeast. And in addition to the first feasibility visit, Dr. Suman has started doing online OPDs along with our field workers in the tea estates. So every week he does online OPDs with patients, and all the patients who are collected are sent for MRI, and the entire expense is taken care of by the Spine Foundation. After doing this for a couple of months, we identified 5 to 6 cases who required investigations, and 3 or 4 of them required early surgery. So this is the second time we are coming in Silchar to do spine surgeries on those tribal patients. I would like to ask Dr. Suman about his contribution to the effort and what he feels is the scope and future of Spine Foundation in Northeast.
Hello sir, and hello everyone. So from the beginning of the days that we have covered around 4.5 months of our consultation, tele and site. So we had 3 site visits with approximately 7 or 8 teleconsultations, where we have seen about 400 of patients, and out of which we have screened nearby 100 patients to be having some of the other symptoms related to spine. On screening those patients from specificity, there were patients around 40 who came down to have red flag signs. We have screened them, we have given them medications for temporary relief, and we have ruled out of those 40 patients, we have ruled out 11 patients who needed investigations. So of those 11 patients, we have come up with 8 patients who were investigated, who were done MRI and necessary blood investigations with x-rays and all, of which we have seen the patients who have come up to surgery, and we have done our first surgical camp at Silchar today, and we have successfully done 2 lumbar decompressions, and 2 patients who had symptoms which could be benefited with blocks. We have given blocks.
And all this was done completely free through the funds of the Spine Foundation.
And that is the motto and site of foundation, to help those who are not getting benefited from any source or not even reached out. So we are reaching those who are not even reached out, or who don't have any access to any medical help or help.
Would you like to say something about your PhD?
So this place, and with Sir's presence, we have got a benefit to explore the valleys of Silchar, specifically on the tribal zones where we are working. The Spine Foundation is basically working on that, and we are trying to study the population and see the problems where we can reach them out on the spine ailments and the treatment, and we are doing a PhD study on that project where we reach out approximately 8,000 of population and see around 11 to 12 villages covering that 8,000 population, and we'll be doing a algorithm of treatment depending on how we can access those patients.
So the motto of the Spine Foundation for the next year or two is going to be providing comprehensive spine care for the tribals. Although this area is almost completely tribal, all the other 15 to 20 centers we have in the foundation has big pockets of tribal areas. So Dr. Suman will also be studying the nature, the specificity, the specific problems the tribals have, their socio-economic background. And this is also going to be done in collaboration with the Assam University and guided by Dr. Vivek, who's the main guide, also Dr. Denny, John, and all of them together will help support Dr. Suman in his thesis on comprehensive spine care for the tribals, not only in Northeast but all over the country. Thank you.